Myself? Shall we all introduce? You guys are on, you can be on video.
Start.
We have tightened up the collar.
That's right.
All right. Hello, Jeremy Taskey here with SpanAmerica. Doing a little overview on one of the types of mattresses, specialty mattresses that were recently purchased by Shalom Cares. As always, a lot of you hopefully know how to reach me, Jade, Deb, with any questions. But I want to help with the understanding of how to set them up, use and care, and also some other training materials I'm leaving with Deb, including cleaning, linen, what to do in case of a power loss, anything like that, as well as survey documentation, potentially. Anything that state may need regarding compliance, regarding MSDS information. SpanAmerica is the preeminent manufacturer in long-term care, and we have you covered before, during, and after your wound care needs. So this particular surface here is called our Safety Supreme. 6 of these were purchased, and it is a dynamic air mattress that can provide 2 different therapy modes. So I wanted to show first and foremost how we connect. Your 2 air hoses connect into this under the Velcro flap. This right here is your fire barrier sleeve, required now by all manufacturers to protect the mattresses themselves. And then we've got 2 connections in here, and they will snap in. And I always recommend snap them in once and leave them in, because this is the hardest part of the connection, is getting in here to actually lock them in. Okay? And let's make sure they both snap.
So you just push them in and they snap in?
Yeah, they snap right into the... Okay, got my 2 snaps. This connects one way, arrow pointing out towards you, and we are connected. Now, audible alarm will obviously go right when we first turn it on. We can mute that. Virtually ready right out of the box. If you had Mrs. Jones on this mattress while we set it up like this, still within 2 to 3 minutes, we're in normal alternating pressure mode.
Right.
One of the ease, if you will, one of the convenient factors of SpanAmerica is ready to go right out of the box. Okay? Now, what it's doing though is it will take up to a couple of minutes. Comes pre-inflated, and ladies and gentlemen, so you know what you're dealing with here. We've got our fluid impermeable nylon cover on this one. We've got an added safety design with our wings that help prevent what we all are trying to avoid. And the other unique feature of SpanAmerica is 4 longitudinal air cells that go head to toe. So we're the only ones that have that design, and that as well as another safety feature to help keep that resident positioned in the center. That's what head-to-toe air cells do versus all the others, the right to left. But also, so you can always check. If you guys ever needed to check, or you had a resident say, I feel like I'm in a hole, or you're ever curious about checking the inflation and the cycle of the system, it's best to go inside the cover and feel your air cells. Right now, they're all firming up. And any second now, we are going to default back into alternating mode. Now, to explain the 2 modes for you all, and this is a stage 4 mattress. We see this used for pain management, prevention, all the way up to stage 4 wounds. And really because you have a comfortable 2 inches of our Geomat foam on top. This design is purposeful, twofold. One is resident comfort. We generally hear ours are more comfortable than those all-air mattresses with just a cover. We also hear that, and from a clinical standpoint, you want the body, those bony prominences, to immerse and really have the surface envelop them. That's how you get lower pressure readings. Individually articulating cells, I always say the true test is put your elbows in here, that's what you want, and comfort is to really support those bony prominences, which helps with your overall pressure readings. We are in normal operating mode. Pretty easy to set up, guys. Hopefully you see the difference, and your time you'll find you'll have extra when you are working with the air mattresses of SpanAmerica. Now, right now it's venting. That's as loud as it will get. I recommend hitting that amber light again so we know we will have that audible alarm if for whatever reason there is a low pressure reading over time. But right now we're in regular standard alternating mode, which is what we recommend unless clinical says otherwise, because you have two different therapies with this surface. You have alternating pressure, which you can feel it. We're still in a dwell period, but what happens is cells 1 and 3 will work in concert, 2 and 4 will work in concert. We'll check back on this, but they work in an inflating, deflating pattern. Okay? So you'll see that. That's what the cells never fully deflate. Okay? There's always that support, which in the case of a power outage, a resident will be safe on this for days, if not months. Weeks, I'm sorry, not months. But if you cap that, then you've got nothing to worry about. Air will stay in there, support will stay, as I mentioned, days if not weeks. So plenty of time in a power outage, not like your all-air mattress where it ends up right on the bed frame. And it's an
Jeremy, I have a
immediate
question.
concern. Yes, sir.
I'm sure this applies more to nursing. If you needed CPR, you got a quick disconnect plug to deflate it.
What we do is we recommend go into auto firm mode. Your cells will fully inflate, and then you
Okay.
follow your protocols from there.
Gotcha.
Because you're exactly right, Randy.
So drain-
We don't have a pull card that's just going to rapidly deflate and put them on the bed frame. So that will stay in that mode for 20 minutes and default back to the original settings, or I can override it that way and it goes back to the comfort level of 1. Now your comfort level is just that. It's a comfort level. This surface is rated for up to 350 pounds in either mode, alternating pressure or lateral rotation, and I'll touch on that. But what you want to do, always, rule of thumb with all SpanAmerica surfaces, start low in that comfort setting and firm it up as needed, kind of like a sleep number surface in essence. If a resident says it's too soft, or you have a resident where the head of the bed is constantly elevated, or they're just a heavier individual, maybe pear-shaped with all that weight in their sacral area. As you can see, the cells are designed larger in the sacral area for better support. And also the idea is the maximum therapeutic benefit is at a lower setting, because again, that body will immerse into the geomat, which is clinically proven to help with the skin, but also it generally will provide that support in any of the range, whether you're at 1, whether you're at 5. Okay? They're all within therapeutic range. What I always recommend from a clinical standpoint, if you guys are going to be setting these up, unless otherwise told, start at a 1, firm it up as needed. There will always be that support. Nobody's going to bottom out on our system.
You got a master switch on the side.
Yeah, that's your on-off right there. These 3 lights illuminated means you're in great working condition. As I mentioned, alternating pressure, getting back to so you guys can feel a little bit of the difference. They're getting a little bit softer. So these 2 are a little bit firmer. These are about to deflate. So now what we can do, guys, is a secondary mode. Underneath where we put our air hoses in, you've got a diagram. Can you see that, Deb? With a toggle switch, a little light switch. I want you guys to see it, because what happens is if this switches to the right, then you can kind of see.
Oh, I see.
You can kind of see the switch, and there on that plate it says alternating pressure. Okay. If we flip it to the left where it says lateral rotation, what I've effectively done is paired off these cells. So 2 will vent, you get a roll in each direction. Something that I know Ruth and Deb, you've heard this when we went through this. Some of the other clinical folks know fully about the different therapy modes. It's just important to know that's how you change it. You don't do anything on that pump.
Okay.
And you've got 2 different therapies. Again, with our head-to-toe air cell design, it's very unique that we can add that very easily to get a wound.
Prevent bed sores.
And either mode does. This is a full treatment surface, a group 2 treatment surface, which either mode is going to be dynamic therapy to help support the overall clinical cause. But sometimes lateral rotation can be a nice adjunct to traditional alternating pressure, depending on that resident, depending on how hard it is to reposition them, how compromised they may be. Paras and quads sometimes we see do well on lateral rotation therapy. So just so you know, let me see, we should have had, see now we're paired off. 1 and 2 are vented, they're never fully deflated. 3 and 4 are firmer.
Right.
And that's how you get, so that's
So you
where
get a
guys
tilt
can get.
without
Yes.
a tilt.
That's where you may hear, I feel like I'm rolling into a hole. And the first thing you're gonna do is go, okay, let's check the mattress. You're not gonna feel anything this way except foam. That's why I say go in and under and verify the cycle, see where your toggle switch is at. Okay? So you've got, I'm gonna put this back into alternating pressure. That's the more common setting. And then I encourage you all to lay on it before in use, feel what your residents are feeling. It's very subtle in its movement. It's not as obtrusive as some of the other air mattresses you might have used before. But this pump will become very familiar to you. You got 6 of these, and then you got 4 additional in an 80 by 42 width. So 3 inches on, this is 80 by 36. That will give you an additional 3 inches on each side. It's not the raised wing variety, but it's very similar in how it works. You'll see the same toggle switch, a different cover, but the same pump will be used.
I like how quiet that is.
I was just gonna say, I always warn, I always encourage you to, if that plug gets knocked out of the wall, resident's not gonna know it. You're not gonna know it because you're right, Randy, this is about the quietest pump you've never heard, which is why it's important. Put your eyes on it when you're coming in and out of the room. Make sure it's still plugged in because it will not be loud. You do have on the back a tiny little filter. Keep in mind this is not active airflow, so I can't tell you how often that might turn brown, but if we check it 6 months from now, I would bet it still looks pretty white like that. And in any case, if it gets to be, you'll see lint or whatever build up, just rinse it, pat it dry, put it back. And then as far as cleaning is concerned, you can clean it as you would clean a foam mattress. Whatever type of disinfectant you use, you know, our recommendations are always neutral, suds and water, but I know you use the chemicals, so wipe it down as you would a foam mattress. You should not have a need to unzip it and mess with the core. Standard protocols right now, I think you guys send a cover to laundry with your air mattresses, and then you clean in between each of those probably 15 or so baffles from head to toe. Is that how it works right now with the other mattresses?
Usually the housekeeper will just wipe it down.
Wipe it down? Okay.
Over.
Good. Then keep it simple. Questions on this particular surface? Our safety supreme. Let's zip this back up.
If we use a cleaner other than soap and water, is it going to stain this cover?
You know, Randy, over time,
Non-bleach, of course.
yeah, over time, you're right. It will fade. It really depends on the care. And some of the recommendations are, you know, any of your standard Lysol wipes, whatever you guys use. We've got a long list of approved chemicals, but it's important, as you see fading, if you see punctures, let's address that immediately. That's a small percentage of the purchase price, and a way to really increase the life of your investment is make sure you replace a cover as you see your covers really get worn. That's a key. And ask yourself, would I want my mom lying on this cover? And if you don't, then it's time to get a new cover. And then again, you've extended the useful life of this product because you don't want anything to seep into the core.
What is the average lifespan of this?
We've seen 5 to 7 years, easy, if you got a good pump. But even more if you need to replace the pump halfway through. This mattress, again, replace the cover, you'll get years and years. No matter your environment, which again, I know your environment is such where you're not going to let incontinence pool. You're going to clean as an issue arises. But I'm always available for any type of re-education, questions, anytime. Happy to help, and that goes with the territory.
Okay. Pretty easy, sir.